Hi, my name is Dr. N. Edward Dourron at Pathways Fertility in Atlanta, Georgia. I want to take a couple minutes to talk about genetic testing of embryos. So the current nomenclature that's used is PGT-A, or pre-implantation genetic testing for aneuploidy, and that's what we used to call PGS, or pre-implantation genetic screening. And that's where we look at all 23 chromosome pairs to identify that they're numerically correct. So for example, Down syndrome is when you have an extra 21 chromosome, or what we call trisomy 21. So that's easy to identify in an embryo where you do PGT-A, because you can identify there's 3 copies of the 21 chromosome. Another common one would be Turner syndrome, where you have a missing X chromosome in a female, and it's called also 45XO. So those are conditions that are easily detected, and it's a good screening test to do for patients over the age of 35 that want to screen their embryos to minimize the risk of miscarriage and lower the risk of having a later diagnosis of a Down syndrome baby or a Turner syndrome baby. So that summarizes PGT-A, or pre-implantation genetic testing for aneuploidy. The other term is called pre-implantation genetic testing for monogenic disorders. Okay, so it's called PGT-M, and that replaces what we used to call as pre-implantation genetic diagnosis, or PGD. And that's essentially where we are honing in on one specific chromosome to identify a problem. So a perfect example here would be if you had a mother and a father that were both carriers for cystic fibrosis. What that means is that when they conceive a baby, that 25% of the time their baby is going to have cystic fibrosis. If that couple were to do PGTM, we know that the defect for cystic fibrosis is located on chromosome number 6, and we can get blood from the dad, blood from the mom, and we actually in the laboratory develop a probe where we can probe all the embryos for the presence of the genetic defect on chromosome 6. It can also be done for colon cancer, for breast cancer, for different conditions, but the important concept with PGTM is that you're honing in exactly on a genetic defect that you know either of the parents are carriers for, and you're trying to eliminate that from the offspring.